This is my lecture on the clinical aspects of cancer. By the end of this lecture, you should be able to list the risk factors and clinical presentations of the top 5 cancers, discuss how cancer is diagnosed, discuss the role of tumor markers, and explain the grading and staging systems of cancer. Risk factors and clinical presentation. Please know the risk factors and clinical signs and symptoms of the top 5 cancers, namely colorectal, lungs, breast, cervical, and prostate. That's table 13.2 of your book. I would like to point out a correction though. Table 13.2 under breast cancer, it says late menarche. That is incorrect. The risk factor is early, not late menarche. Menarche means the onset of first menses. The risk for breast cancer increases with the longer exposure to hormones, which means early menses and late menopause, and the use of birth control pills. So, diagnosing cancer. Solid cancers are diagnosed through biopsy for blood cancers. Typically, if this involves CBC as initial diagnosis, plus there are tumor markers. Examples of tumor markers are PSA, which is prostate-specific antigen, CEA, which is carcinoembryonic antigen, cancer antigen 125, P53, and alpha-fetoprotein. So, what are these tumor markers? Blood tests are performed to detect the presence of certain tumor markers. A tumor marker is a substance, usually a protein, which is produced by tumor cells or by other cells in response to the presence of a tumor. So why not use tumor markers to diagnose cancers? 2 reasons: low sensitivity and low specificity. Low sensitivity. It means the presence of a tumor marker does not necessarily indicate cancer. Low specificity. This means a negative result for a tumor marker does not rule out cancer. What is the use of tumor markers then? Well, it helps confirm or validate the cancer diagnosis. It is also useful in surveillance or recurrence. So the serial levels, you look at the serial levels, are they increasing? It is also, tumor markers are also useful in gauging the response to treatment. Are the serial levels decreasing or the same? Knowing the things on this slide will help you respond to a patient who asks you about the results of tumor markers. So it is important. I remember one time a nurse was asking why alpha-fetoprotein, typically screening in pregnant mothers, is being performed on a male. The answer is it is a tumor marker for liver cancer. So now you know. Grading of malignant tumors. This refers to the aggressiveness of cancer. Along with a biopsy, a pathologist will grade the tumor. The tumor grade refers to how aggressive the cells are. The higher the grade, the more aggressive the tumor cells are. Two of the ways that the pathologist grades the tumor is looking under the microscope at the percentage or number of dividing cells, or this is called the mitotic index. The more cells that are in mitosis or cell division, the higher the tumor grade. A second criterion is the morphology of the tumor cell. If the tumor cell looks drastically different from the normal cell, then the higher the grade of the tumor. So G1 or grade 1 is low grade. So in other words, the tumor cells look more similar to normal cells. For example, the cytoplasm and nuclear ratio. And a grade 1 tumor has a low mitotic index. In other words, there are less of them who are in the state of mitosis or division. Grade 4 means that cancer is aggressive. The nucleus is relatively bigger and it has a high mitotic index. Staging of the cancer, specifically a solid tumor. So this is the TNM system. For solid tumors, as in breast cancer, the cancer is classified by TNM. T stands for tumor, N stands for node, and M stands for metastasis. T refers to tumor size. The range is from T1 to T4 with increasing size. So for example, T1 is less than 2 centimeters. N refers to node involvement. The range is N0 with no lymph node involvement, and N1 to N3 means increasing number of nodes that are malignant. M refers to metastasis, and the range is either M0 or M1. M0 meaning there are no distant metastases, and M1 means there's a distant metastasis. Another way by which cancer may be staged is the numeric system, which is 0 to 4. Stage 0, what does it mean? Abnormal cells are present but have not spread to nearby tissue. This is also called carcinoma in situ. In stage 1, stage 2, and stage 3, cancer is present. The higher the number, the larger the cancer tumor, and the more it has spread into nearby tissues. Stage 4 means the cancer has spread to distant parts of the body. In other words, there's metastasis. Why stage the cancer? Because staging is useful in prognosis. For example, stage 0 in breast cancer has a 5-year survival rate of 100%, while stage 4 is dramatically lower, 26%. Staging also guides treatment. Stage 0 in breast cancer might require only oral chemotherapy, such as tamoxifen, for 5 years. Later stages might require a combination or all of the treatment modalities, which are surgery, radiation, and chemotherapy. This ends my lecture. Thank you.